Hello, welcome to case-based learning of cardiac MRI on mricardiac.com. This post describes role of CMR in workup of transplanted heart. This patient underwent cardiac transplant in 2017. There was clinical suspicion of graft rejection and hence repeated endomyocardial biopsies were performed. Recent biopsy report showed myocyte damage with antibody-mediated rejection. However, these patients require a serial follow-up, and endomyocardial biopsy is an invasive procedure. Cardiac MRI has important role being it non-invasive. So let us understand how do we work up these patients. So T2 weighted images or stir images are the mainstay of imaging, and they also help to estimate the amount of myocardial edema. Important to compare the ROI in the skeletal muscle and the normal myocardium, and where we can calculate the edema ratio. More importantly is the T2 relaxation time, which can either be obtained on the normal routine T2 weighted or stir images or T2 mapping images. T2 mapping images are more robust, reproducible, and highly sensitive. Rejection patients have a lot of interstitial edema and lymphocyte infiltrate. Because of that, free water content is increased, and this results in increased T2 relaxation time. Longer T2 relaxation time, more than 56 milliseconds, have 97% negative predictive value. So this T2 relaxation time is the mainstay of detecting rejection on cardiac MR. It is reproducible, and hence even follow-up of these patients on immunosuppressive therapy can be performed with cardiac MR. More importantly, always do a global assessment, taking T2 weighted images in base, mid, and apical LV cavity. T1 mapping images with ECV expansion will detect interstitial fibrosis. As you see in this case, ECV was also increased. This interstitial fibrosis correlates with degree of fibrosis on the endomyocardial biopsy, and it is very important for the disease progression and efficacy of treatment. Systolic function of both ventricles can also be reduced. More than left ventricle, right ventricle is involved because the thin wall of right ventricle is less resilient in maintaining diastolic volume. Indexed RV volumes predict 5-year outcome. So it is important to accurately detect the volume and function of both ventricles. Late gadolinium enhancement, though routinely obtained, have very less sensitivity and diagnostic accuracy in detecting rejection. Increasing number of cardiac transplant with improved life expectancy. So these patients will be definitely require more follow-up. There are two major impediments for long-term survival, which include graft rejection and cardiac allograft vasculopathy, also known as CAV. These patients, CAV patients, are usually followed up on catheter angiography. Graft rejection, basically, it could be either cellular rejection or antibody-mediated rejections. And these patients require a regular follow-up with endomyocardial biopsies. However, it is more invasive. In endomyocardial biopsies, a catheter is passed and it is taken through the RV surface of interventricular septum. However, there is a potential to damage tricuspid valve. Some amount of myocardial perforation, arrhythmia can develop. So because of this invasive nature, it is important to switch over to some non-invasive imaging modalities such as cardiac MR. CMR is very sensitive, especially with this T2 mapping images, to detect signs of inflammation and edema. It can also provide accurate evaluation of the size, wall thickness, systolic and diastolic function. Important to understand that during the first month post-transplant, there will be more edema with some increase in mass and thickness. This patient will always have persistent tachycardia, some amount of hypertension and RV dysfunction. So it is important to understand these normal features to identify what is abnormal. This is grading scheme of cardiac rejection severity. This is through the International Society of Heart and Lung Transplant endomyocardial biopsy grading scheme. Depending on the severity of the reduction and the foci of infiltrates and myocyte damage, it is graded. It is important that these patients are regularly assessed and close follow-up is done. And this is how we can improve life expectancy in these patients. This is our book, Cardiac MRI Simplified. Any feedback and suggestion, please mail us on info@mricardiac.com. And this is my personal email address. Thank you.